Hello, my name is Dr. Brian Raid, and I'm a naturopathic doctor. And this is a video about a scenario that unfortunately sometimes we run into where we have patients who are dealing with small intestine bacterial overgrowth, also known as SIBO or SIBO. And it's known that SIBO can potentially cause a wide range of different symptoms beyond just gastrointestinal symptoms. It can cause fatigue, can cause joint pain, contribute to skin issues, bladder issues. The list can go on and on. Sometimes it underpins different autoimmune conditions. And so sometimes patients will come into my office and they are frustrated because they had a diagnosis of SIBO, they had the digestive issues, etc., and maybe fatigue, joint pain, different things like that. And the SIBO is treated and their gut's feeling better, but they still have some of these other systemic symptoms. And they're disappointed, understandably, because they thought, oh, treat the SIBO and hopefully all those other symptoms are going to go away. And in many cases, those other symptoms do go away or at the very least get significantly better. But unfortunately, in some cases, they don't. And so oftentimes that's when patients will come to see me thinking like, oh, or saying like, well, I was working with the SIBO expert and treated my SIBO and this and that's improved, but I'm still having other issues. What might be going on? And sometimes I see that with my own patients as well, where they come in, they have a myriad of symptoms going on. We oftentimes will start with the gut because it's, for many reasons. Maybe I'll do another video about why that's so important at some point, but oftentimes start with the gut issues, and quite frankly, oftentimes other things get better. But sometimes they'll come back and say, like, yeah, I'm better in this way, but I'm still having some of these other symptoms. So I wanted to put together a video to talk about some of the most common causes that I've seen that are the underlying reasons why there's still persisting symptoms even after SIBO has been treated. So this is not an exhaustive list, but in my experience, the most common reasons I see for patients still having non-gastrointestinal issues following thorough treatment for SIBO. So top of the list would definitely be mold illness or mold-related issues. So in many of those cases, the underlying persisting symptoms are related to a past or a current mold exposure. And so in that case, we do appropriate testing or a therapeutic trial to investigate that aspect of things. It's also fairly common to, if it's not mold, or sometimes it's mold and other things, but if it's not specifically related to mold or just related to mold, then it can be related to other or it could be related to different systemic infections. So whether it's with the Lyme disease causing bacteria, whether it's Epstein-Barr virus, whether it's mycoplasma, whether it's Bartonella. So some type of a chronic infection is a relatively common cause of persisting symptoms when SIBO is resolved, but there's still other systemic symptoms going on. In some cases, it's related to underlying nutrient deficiencies. So just due to the presence of the SIBO, sometimes for years or decades in some cases, then the body has just become depleted in certain key nutrients that are required to make energy on a cellular level. Many nutrients are needed for the mitochondria to function in order to make enough energy. Or in other cases, there's just been enough persisting inflammation in the gut that it's led to this cascading effect where there's just, quite frankly, elevated inflammatory potential throughout the rest of the body. And that can translate into brain fog or joint pain or muscle aches and pains or bladder issues or whatnot. So in those cases, we either need to work with immunomodulating herbs or immunomodulating nutraceuticals or maybe immunomodulating pharmaceuticals, or we need to use a really tailored therapy like low-dose immunotherapy to get at these specific causal agents, typically being microbes that are perpetuating those ongoing issues. So the take-home message is that if one is treated for SIBO and gut issues are better, but there's other symptoms still kicking around, it means there's something that's not SIBO that was causing those other issues. And unfortunately, SIBO does like to party with other causal factors on a semi-regular basis, at least in my practice where I mostly treat very complicated cases. So I hope that this information is helpful. If you are interested in learning more about mitochondrial dysfunction, please note that I do have a free to access 1 hour long course essentially or lecture about mitochondrial dysfunction, how it interplays with other types of chronic illness. So if you haven't come across that video yet, just sign up for my mailing list. Either go to the link in my bio in my link tree if you're watching this on Instagram, or I'll have it posted below if you're watching in the comment section if you are, or in the video description section if you're watching this on Facebook or on YouTube. So please feel free to access that free resource, and I hope that it's really helpful for you. If you have any questions about SIBO or mitochondrial dysfunction or anything really to do with any chronic malady whatsoever, please feel free to post that in the comment section below, and I'll do my best to post a video reply as soon as I can.